Hi, I'm Daniel Chase. I'm a registered nurse. I work in the
Ranking number 21 County.
I work in the emergency department where I'm doing my video now at Piedmont Henry Hospital. I've been an emergency room nurse for about a year now. I worked as a tech before. Excuse me. I worked as a tech in the emergency room before being a nurse while I was in school. So it's been about 3 years almost now that I've been in the ER. So during my time working in the ER, I've had many opportunities to experience different cultures, both as a tech and as an RN. There are many times that I've experienced cultures that are completely different and some that are a little different. And when you encounter these cultures, you have to have a different approach. And the best way to do that is to educate yourself. So I decided to do my project on female Muslim patients. Especially as a male nurse, that's a subject that requires some extra education, some extra time, and an extra thought process. So let me introduce my nurses real quick. This is Kelly. Kelly, just tell me how long you've been a nurse real quick.
I've been a nurse for 8 years here in
Okay.
the emergency room.
Okay, thank you. And this is Justin.
Hey, I've been a nurse for 3 years here.
Okay, thanks. And this is Dr. Towater.
Hi,
Hi, Dr.
Hi.
Towater. Okay, so culturally competent care of female Muslim patients. One of the first things that you need to be aware of, especially as a male nurse, is that female Muslim patients have a different idea about modesty. That's the reason why in public they cover themselves. They wear special clothing to preserve a higher level of modesty than most Caucasian women. The family dynamics with female Muslim patients is a very important aspect also. It's important to know who is the decision maker in the family. Sometimes that is the husband, and sometimes it is the eldest male of the family. When you are going to have a female Muslim patient, one of the first things you need to think of also is before you go into the room to speak with the patient, you need to understand that you may have male family members who wait outside the room. I've had examples where I had a female Muslim patient, and before I even got into the room to talk to the patient, there were 3 or 4 male family members outside the room. They are very protective of their women. So it's a good idea to walk over and just to have a conversation with them. Make sure that they understand some of the procedures that are going to be done, and ask them if they have any questions, and take a little time to decide if they feel comfortable with what you need to do with your patient. And when you do go into the patient room, remember that it may not be appropriate for you to directly address the female patient. It may be more appropriate for you to speak to the male in the room, which would be her husband or her significant other, maybe her father, maybe her grandfather. It may be more appropriate for you to speak to them about what's going on and test results and what needs to be done next than the actual patient. Either way, make sure that you do address the male significant other in all decision making and all health care. Sometimes it may be appropriate. It's okay. Sometimes it may be appropriate if you're a male nurse to you would go and you would assess the situation, as we do as nurses, assess whether it would be more appropriate to switch assignments with a female nurse so that the female nurse takes care of the female Muslim patient. Either case, you still need to remember that there are certain dynamics that need to be understood, even if you're the female, such as I mentioned a minute ago, about the family leader, the person that makes the healthcare decisions. Those things need to be taken into account, whether you're a male or a female. Female Muslim patients may be offended by being touched in certain areas that you may not consider offensive, and that needs to be talked about beforehand. And that's something that the nurse and the provider both need to do. Let's see. Take the time to explain in detail. You want to give Justin the camera?
You might hear him with us.
It may be something you need to explain up front, the procedure, what's going to happen, and make sure that the female patient is okay with being touched in those ways. And if she's not, try to come up with a different alternative treatments if they can be provided. And like I said, most important, don't rush into the care of a female Muslim patient. Take time to speak with the family and to plan ahead so that you can preserve her modesty, preserve the dynamics of the family, and show them a certain respect that they are used to in their culture, whether it be your culture or not. And educate yourself so that you know about certain things that are appropriate and not appropriate before you encounter this patient. One other thing that I've spoken with other nurses about is a difference that with female Muslim patients. An OB nurse told me that a lot of female Muslim patients like to give birth in a squatting position, which is different and requires a different approach to childbirth. So those are things that you can find out if you speak to the patient ahead of time and ask them what their preferences are on certain things. I'm Daniel Chase, and that's been my video. Thank you for your time.